Hi, my name is Wayne Guerra, and I'm the Chief Medical Officer and co-founder of iTriage. Bipolar disorder is a mental condition that is characterized by patients having pretty significant mood swings from major depression to mania. Major depression is defined as severe sadness, patients don't want to get out of bed, they really don't want to do anything, they don't look forward to anything, they can even stop eating. It's quite serious. Mania is just the opposite. It's defined as excessive energy. Patients sometimes don't sleep for many hours, be up for 2 full days. They make reckless decisions in their personal life and in investing, take reckless risks with sports and other activities, and have increased use of alcohol and other drugs. So there's a couple types of different bipolar disorder. Bipolar disorder type 1 is where a patient manifests both the depression and the mania. In bipolar disorder type 2, they have the depression component, but the activities that they have with excessive energy almost make the definition of mania, but don't quite. So they call that type 2. There's also a milder form called cyclothymia, where patients don't have symptoms severe enough to be defined as major depression and don't have symptoms severe enough to be defined as mania. And so that's how those are classified. The people that are at most risk are, it happens to equal numbers of males and females, but it usually appears in the ages between 15 and 25. These rapid swings in mood can happen on a daily basis or a weekly basis. There isn't a particular test, like a blood test or an imaging test to diagnose a person. Many times a healthcare provider will do some testing to rule out other causes of the symptoms, but the diagnosis is really made by taking a good psychiatric and psychological evaluation, by asking questions. Sometimes the healthcare provider will even have the patient do a mood chart and write down what they're feeling at different times of day to be able to map out and be able to diagnose the patient. Typically, yes, but it's important to know that treatment is lifelong, and it's just not medications. It's also psychological counseling and even psychotherapy, and sometimes during a really bad episode, maybe in a brief hospitalization. Also important to remember that there's no one single drug regimen that works for everyone. Typically, a healthcare provider will start 1 or 2 medications, monitor the patient closely, see how they're doing, and then make adjustments. Maybe add a medication, take away a medication, increase a dose. So really important to have good feedback and communication between that time when medications are started. It's also important for patients when they start feeling better. It's called a maintenance treatment, to not stop their treatment, not stop their counseling sessions, and not stop their medications, because that could cause an exacerbation. You know, if you see someone that you think has bipolar disorder, really encourage them to get treatment. You know, certainly don't try to diagnose them, but encourage them to get in to see a healthcare provider and see if that really is the problem. That's the most important thing. Also, if because patients without treatment have severe consequences. I mean, they can lose their job, lose contact with their family, and even lose their life through suicide. Corollary of that would be if you see a patient that you think has, or a person, loved one, friend that you think has bipolar disorder, and you think they're having suicidal thoughts, to go ahead and call 911 and have the paramedics come see them. I know it's a huge invasion of that person's privacy, but you might just be saving their life.